Welcome back, everybody, to the Deep Dive, where we help you cut through all that healthcare and tech news you need to know.
Exactly. We get it. You've got meetings and deadlines and a million things going on, so we read all those long articles and reports for you.
So you can just sit back, relax, and enjoy the top insights and maybe even some surprising details that you didn't see coming.
Right.
Today, we're going to dive into the latest news on government efficiency initiatives.
Some hospital bankruptcies.
Oh, yeah, those are always fun.
That's fair.
And then some big things happening with digital health.
AI.
All good stuff.
Yeah.
We'll also be checking out this interesting trend towards what they're calling analog wellness.
And we'll touch on some of the top public health concerns that are, cropping up.
So let's get started.
Yeah, okay.
First up, the Department of Government Efficiency. You might know it as DOGE.
DOGE.
It's stirring up a lot of controversy.
Yeah.
Elon Musk's initiative now has access to CMS data. That's Medicare and Medicaid records.
Mm-hmm.
CMS says it's all about, streamlining things.
Finding efficiencies.
Yeah, making things more efficient. And it's supposedly in line with President Trump's goals.
Well, of course.
But not everyone is happy about it.
Well, 14 attorneys general are actually suing over DOGE's access to this sensitive personal information, so.
Oh, yeah. Makes you wonder, what does all this mean for data privacy in healthcare?
Right. I mean, could this help accelerate innovation, or could this be a gateway to misuse?
That's a tough question.
Yeah, big question.
Speaking of tough questions, the healthcare industry itself is under a lot of pressure these days.
Definitely.
We've seen a number of hospitals file for bankruptcy lately,
Yeah.
including Bellevue Hospital in Ohio
Mm-hmm.
and Prospect Medical Holdings. They own Crozer Health.
And Crozer's situation is interesting because a deal to help them out actually fell through,
Oh, wow.
which forced them into receivership. Regulators actually had to step in and provide $20 million just to keep them running for another month.
Oh, man.
Yeah.
That's rough.
Yeah.
I mean, these bankruptcies really highlight just how much financial pressure there is on healthcare providers.
For sure. Staffing costs are going up and up. Plus, the political landscape in Washington is always changing.
Yeah.
And then you've got the world of mergers and acquisitions, which can be pretty brutal.
Yeah. Not everybody makes it out of that. On top of all that, we've got some thought-provoking criticism coming from inside the medical community.
Oh, yeah.
Yeah, there's a physician writing in the Journal of the American Medical Association
Right.
criticizing the House of Medicine for not speaking up more
About.
what they see as attacks on, compassion and partnership in healthcare. And for anyone who isn't familiar with JAMA,
Right.
it's a very well-respected, peer-reviewed medical journal.
It is.
So this is a pretty big deal.
This article is basically saying that there's this deeper ethical dilemma going on within the medical field.
You think?
I mean, are they doing enough to advocate for patients with all these changes happening? It's a call to action.
I see what you mean. Okay, let's move on to something a bit more upbeat. What's going on in digital health and AI?
Well, Teladoc Health is acquiring Catapult Health
For how much?
for $65 million, which really just makes their position in the chronic care market even stronger.
So what does that mean exactly?
It means that Teladoc can now use another avenue to get patients into their chronic care programs. It's a pretty smart expansion strategy for telehealth.
Smart. And speaking of expansion, OpenAI is looking for places to build 5 to 10 new Stargate AI data centers all over the U.S.
Wow.
Big investment in AI infrastructure. Shows you that demand for AI solutions is growing.
Definitely. But even AI has its challenges these days.
Like what?
Well, there's actually some debate right now about whether AI models can experience brain fog.
Brain fog.
Yeah.
Really? Are we giving AI too much credit here?
Maybe, but the idea that AI models could actually have their performance drop because of data overload or things getting too complicated
Interesting.
is a fascinating one. I mean, it makes you wonder about the limits of AI and what might happen if we rely on it too much.
Okay, so while the digital world keeps moving forward, there's also this really interesting trend going in the opposite direction. They're calling it analog wellness.
Oh, yeah, I've heard of that.
Yeah, people seem to be looking for a break from all the digital stuff,
It makes sense.
leading to things like, digital detoxes
Mm-hmm.
and social rewilding, which basically means disconnecting from tech and reconnecting with nature.
Right.
And then there's even a comeback for physical bookstores.
Yeah, that is interesting. Do you think this analog wellness is just a fad, or is it something bigger?
That's a good question.
I mean, is it a sign that society is rethinking how we use technology?
And how does that impact healthcare workers
Yeah.
who are often overwhelmed with digital tools and information already.
Right.
It's kind of a paradox, isn't it? We're using all this technology to improve efficiency and access to care,
Right.
but at the same time, we want simpler, more analog experiences.
We do. And this is where ambient speech technology comes in. KLAS research says that hospitals are adopting this really fast
For what?
to streamline clinical documentation and try to fight burnout.
So they're using tech to get back some of that human connection that gets lost in the digital world.
It seems so.
How's that working out?
Well, it's hard to say right now. It depends on how it's implemented and how it fits in with clinical workflows. But the potential is there.
So how are hospitals handling the patient experience side of things?
Good question. I mean, happy patients generally have better outcomes.
Right.
And more healthcare organizations are recognizing that a positive patient experience can really benefit them.
In what ways?
Well, for one, it seems like simplifying their technology choices and minimizing what they call technical debt is really helpful.
Okay, hold on. Technical debt. What's that?
Imagine a hospital's IT infrastructure as like a house. Over time, they add all these new systems and tech without really integrating them or updating old stuff.
Makes sense.
And the house becomes cluttered and inefficient. That's technical debt.
I get it.
And it slows things down, causes errors, and just makes things frustrating for everyone.
Sounds like it.
But if providers can reduce that debt, they can focus more on really connecting with patients and making the whole experience better.
Like decluttering your digital house
Exactly.
to make a more welcoming space.
Hopefully.
Okay, but outside of the hospital, it seems like we've got some public health issues on our hands.
Like what?
Like flu rates are shooting up again.
Oh.
Across the U.S.,
Mhm.
a second peak this season.
Yeah,
Definitely concerning.
it is.
Shows how important it is to keep pushing vaccination efforts.
Mm-hmm.
And then there are also these growing gaps in access to primary care.
Oh, right. Some states are worse than others.
Definitely.
Hmm.
And this problem is even worse because some physician practices are closing down.
Like that one on Martha's Vineyard.
Exactly. So we've got pressure on the system from every direction.
Yeah.
Financial strain on hospitals, staff shortages, and now these access issues. It's a lot to deal with.
It is. But there is some good news. There's this new law aiming to ensure that incarcerated youth have Medicaid coverage when they're released.
Yeah.
That's a big step toward fixing a critical gap in the safety net.
So if we can connect these young people with health coverage,
Right.
we can hopefully support them and keep them from ending up back in the system.
Exactly.
That's good news. And speaking of vulnerable populations, it seems like there's a lot more focus on women's longevity in healthcare.
Yeah, it's interesting. Most of the longevity market has always been focused on men.
Really?
But now there's this growing awareness of the unique health needs and experiences of women.
It's about time.
It is. And this is leading to new research and initiatives that are specifically about helping women live longer and healthier lives.
Okay, so let's switch gears and talk about medical devices and pharmaceuticals. What's happening there?
Zimmer Biomet is making moves in the ambulatory surgery center market.
Really?
They just acquired Paragon 28. They specialize in foot and ankle orthopedics.
Interesting. So Zimmer Biomet is basically betting that outpatient procedures will keep growing as healthcare systems look for ways to save money.
It seems that way.
Smart move. Are there any other big acquisitions or partnerships happening?
Yeah. Syncora, they're a global healthcare company,
Okay.
and they're trying to deal with these ongoing drug shortages.
Oh, right. Those are still a problem.
By expanding their Sure Supply program to include 200 crucial medications.
So is this program going to actually fix those shortages?
Well, expanding access to critical medications is a good start.
Right.
But it doesn't address the root causes of those shortages.
Which are?
Things like disruptions in manufacturing supply chain problems and pricing pressure.
Yeah, it's complicated.
It is.
Okay, so the VA is finally moving forward with their Oracle Cerner EHR system after putting it on hold because of all those technical and operational issues.
About time.
This project has been a roller coaster.
What do you think is going to happen? It's hard to say, but I'm definitely interested to see how this huge implementation plays out, and hopefully they've learned from those early setbacks.
Yeah, I mean, taking care of our veterans is important.
It is.
Speaking of IT, it looks like more and more healthcare organizations are using managed IT services to handle all the tech stuff.
Makes sense.
They're dealing with limited resources and need specialized experts.
Right.
So they're partnering with outside companies to take care of IT support so their own teams can focus on bigger things.
Right.
It's all about efficiency.
It is. And you know what else might make things more efficient? AI. There's this report suggesting that it could change the game for provider revenue cycles.
Really? How so?
Well, Mercy Health says that they've completely transformed their revenue cycle operations using this AI-powered platform from Orintra,
What does it do?
autonomous coding. And the potential for AI to make billing and coding better is huge.
I bet.
And we're probably going to see a lot more of it in the future.
So AI could basically help providers get paid faster and more accurately.
Exactly. It's all about streamlining those processes so providers can be more financially stable and focus on providing quality care.
Makes sense. Okay, last news item before we get into our takeaways.
All right.
University of Kentucky Healthcare is putting a lot of money into their IT infrastructure.
How much?
$95 million.
Wow. What for?
They're implementing Epic and Workday software.
Big project.
Probably because they need to modernize their systems, improve data integration, and streamline their administrative processes.
Makes sense.
It's a big investment,
Yeah,
but it could really pay off in the long run.
absolutely. In terms of efficiency and patient care.
So we're seeing this trend toward efficiency and innovation everywhere,
Yeah.
both in healthcare organizations and in the broader technology world. It's a lot to think about. What do you think?
I think healthcare is at a turning point. It's facing pressure from all sides. Financial strain, technological disruption, ethical dilemmas, and a constantly changing landscape. It's a lot to manage. But even with all of that, there's this sense of optimism. And people are really trying to find solutions. AI, digital health, and this renewed focus on patient experience could completely change healthcare.
For the better.
Yeah, making it more personalized, proactive, and holistic.
That's a good point. It's not just about getting through tough times, but also about creating a better future.
Absolutely.
But how do we do that? Where do we even begin?
So I think it takes thoughtful leadership, collaboration,
Hmm.
and a willingness to embrace change. But you have to stay true to those core values of healthcare, compassion, equity, and, putting the patient first.
That's easy to say,
Right.
but it's hard to actually do.
Yeah.
Especially when you're talking about these huge issues like data privacy and access to care.
Absolutely. No easy answers here. But I think there are some good signs, like the debate around DOGE and CMS data. It's controversial, but at least people are talking about data privacy and security.
It's time.
Right. It's like finally putting a spotlight on a problem that's been there all along.
And hopefully all this attention will lead to better safeguards and policies that actually protect patient data while still allowing for, innovation.
Right. Speaking of innovation, remember those AI advancements we were talking about?
Yeah,
What happens if AI starts experiencing brain fog, like those experts were saying?
that's a good question.
I mean, if these models get overloaded or start making mistakes, it could have some serious consequences, especially in healthcare, where those decisions can be life or death.
Right. So it's not just about what AI can do, but about making sure we use it responsibly.
Exactly. We need to have really thorough testing and validation processes for AI, especially in healthcare, and clear ethical guidelines for developing and using these technologies.
It's like we're building this powerful engine, but we still haven't figured out how to steer it.
That's a great way to put it. And this brings us back to the human element of healthcare. Technology is amazing, but it can't replace things like human connection, empathy, compassion.
And that's where this whole analog wellness trend comes in, right?
I think so. It reminds us that well-being isn't just about technology. It's about connecting with ourselves, with other people, with nature.
So maybe it's not about getting rid of technology, but finding a better way to live with it,
Right. Using it to improve our lives without letting it take over.
finding a balance.
Exactly. And maybe healthcare can show us how to do that, how technology and humanity can actually work together.
I like that. And as we try to navigate all of this, it's important to remember that we have a say in the future of healthcare.
Yeah. It's not set in stone.
We're shaping it right now with the choices we make.
Every day.
And speaking of choices, we've covered a lot today. Government initiatives, hospital bankruptcies, AI advancements, analog wellness.
A lot going on.
It's a lot. And it's changing all the time. So
Stay curious.
stay engaged. So for our listener, we'll leave you with this.
As you go through your own healthcare journey, stay informed. Ask questions and speak up for yourself.
Your health matters.
And the future of healthcare depends on all of us.
And until next time, this is The Deep Dive. Signing off. It really does feel like healthcare's at this crossroads.
Yeah, I think so too. The decisions that are made right now are going to have a big impact, down the road. And it's not just about politicians or people in charge of things.
Right? It's about us, too. Everybody.
Yeah.
As patients, consumers, citizens, we all have a part in shaping the future of healthcare.
So let's go back to all that news we talked about today. What do you think is going to have the biggest impact?
For me, it's AI and healthcare coming together. I mean, AI could really change how we diagnose, treat, and even prevent disease.
For sure.
But then there are all those concerns about bias and privacy and, things going wrong that we didn't expect.
Mm-hmm.
We got to be careful. We got to make sure that these technologies are developed and used in the right way.
Yeah, I agree. And we can't forget about the people you know. Healthcare is all about taking care of each other. And as much as technology can help, it can't replace those human things, like empathy and that real connection that makes people feel cared for.
So how do we find that balance? How do we use technology without losing that human touch in healthcare?
I think we have to remember that technology isn't a magic bullet, it's a tool. And like any tool, it can be used for good or bad. We have to know its limitations and be aware of the risks, and always put the needs of the patients first.
And we have to make sure that everybody can benefit from these advancements, no matter their income or where they live or their background.
That's right. Healthcare is a right, not a privilege. And we need a system that's built on that idea, a system that everyone can access, that's affordable, and that puts patients at the center.
So to everyone listening out there, as you sort through all of this information, what are some of the key things you should remember?
I would say stay informed, keep learning, and don't be afraid to ask questions. The healthcare world is always changing, and we all need to understand those changes and how they might affect us.
And remember, you have a voice. Speak up for yourself, for your family, for the kind of healthcare system you want to see.
The future of healthcare is up to us. It's being shaped right now by the choices we make, the conversations we have, and the things we do.
So stay involved, stay curious, stay hopeful. And until next time, this has been The Deep Dive.